Welcome to another Petoskey Strong Hot Topics Focus on Health. I'm Nikki Devitt, president of the Petoskey Regional Chamber of Commerce, and I am joined once again by Dr. Karen DenBesten, the Infectious Disease Specialist with McLaren Northern Michigan. Thank you for joining me again today, Dr. DenBesten.
Yeah, thank you, Nikki, and thanks for having me.
Well, here we are into May now, and we have a plan, the Michigan Vacc to Normal plan. So let's talk a little bit about this. For a long time now, a lot of us have been looking at what does it look like to get back to normal again, to back to regular business, especially from a business community standpoint. Our businesses have done all they can with COVID safety protocols, protecting not only themselves, their staff, and the community, but it's also what are those next steps? And the Vacc to Normal plan is intended to be that guideline and guidance that gets us to the point of everybody sheds a mask, all doors are open, and society resumes where we were, well over a year ago. And so that's strategized based on vaccine, first dose, and then plus 2 weeks. So currently as a state, we're a little over 50%, 50.9%, I believe, of first dose vaccinations. And our first hurdle to get to is 55% of the population. And then 2 weeks from that date of the state of Michigan, we'll be able to go, the remote work ban will be lifted. And that's something that we've talked about a long time, the importance of if a business can be safe, they should have that ability to have their employees back. So some people are talking about these numbers, 55%, 60, 65, 70% being the ultimate goal, being too difficult of a stretch goal to hit. So how do you, I think that it's great that we have goals and opportunities now, but let's talk a little bit about where we stand right now as a county and what we're seeing in vaccinations and what those goals look like for us as a state.
Yeah, I think that it's really good to have some numbers and some goals. We really don't know the exact number that you need in order to get herd immunity, but the general thought is 70 to 80% of people need to be immunized to have the herd immunity necessary to prevent the spread of COVID. So I think that these are really very realistic goals as far as the virus is concerned to prevent the spread. Getting people to get on board and get immunized, that's going to be the difficult part. But I do think in Emmett County, because of a lot of good information getting out there, we are seeing that we are reaching those numbers. I think we're upwards of 60% in Emmett County being immunized, and in the state of Michigan, 50%. So we are really doing well. We need to reach those people, though, that haven't been immunized yet, and just one-on-one get them the information that they need to answer their questions and concerns, so they realize that these are very highly effective, good, safe immunizations. If we can get enough people immunized, then we can get to that point where we can be back to business and we can be with our friends and our families and do all the things we want to do. It's so close. It's within our reach. We just need to get past this next hurdle and get there.
You're right. We are so close to being back. Under our current, Michigan Department of Health and Human Services epidemic order, we still have a lot of restrictions, but we also have some things that have loosened up a little bit, and it's because of the percentage of population that's vaccinated. So, we have now, and it kind of followed the CDC guidelines in regards to fully vaccinated individuals can do residential gatherings as long as they're not symptomatic. And I mean, that's huge. Just the thought, I'm going to be really honest, just the thought of having dinner with friends at somebody's house and hugging everyone is like, that's fantastic. And getting there through group vaccination is the big part of it. And our businesses, they want to be fully open as well. They want all of their staff back. So it does help for a business owner to provide as much information as possible for their employees in regards to vaccinations. Connect them with the health department, the hospital, the chamber. We have resources as well, so that those that are hesitating to get vaccinated can get the pertinent information and make an educated personal decision.
Correct. I, especially as we move into the summer, the businesses here get very busy, and you need to have a solid, stable workforce. Right now, if there's a case of COVID in your restaurant or in your business, people are quarantined out, and that could shut down your business. By getting everybody and encourage everybody in your business to be immunized, you can keep working and you don't have to be shut down or quarantined when there's an exposure. So it really does allow for freedom and allows you to keep your business open and going. You're absolutely right. You need to go to trusted sources of information with these immunizations. I can tell you they are so effective, highly effective, not only at protecting you from getting sick and ill when you get, from COVID, but also preventing transmission of COVID. Very safe, very good, very effective vaccines. But people have real legitimate concerns. So I would encourage them to, reach out to me, reach out to the Department of Public Health, their own physician, to get the good information they need to make these decisions. But there's a lot of misinformation trending out there. Most of it, is without validity to it.
Yeah, and don't trust what's on social media necessarily. Talk to somebody that you trust, and talk to your fellow community members as well to get that information. As you said, as to get back to businesses, our business are looking at this as, I need my staff, especially now when we have such a workforce crisis. I need all my staff on as much as possible to be up and going, and getting our community back to it is what we really want to see going forward. Can you tell me a little bit too, though? We're looking at a point in time where, when we talked just a few months ago, waiting lists for vaccines, now it's the availability is everywhere. So it's not even that you can't maybe find the time to get vaccinated, or it's just been difficult. If you look in the right places, vaccines are available everywhere right now.
Yeah, there's great availability with immunizations. Back a few months ago, we were rolling out the vaccines in a priority type fashion, getting older people immunized and frontline workers immunized. And vaccine production has really ramped up, and now it's widely available with a simple search on your phone. The Department of Public Health, the most of the pharmacies, Walgreens, Rite Aid, they're really everywhere. So there should really be no barriers to get immunized. And there are even pop-up walk-in clinics that you can go to get immunized. So there really shouldn't be barriers to get immunized. I am hopeful and that the FDA is going to release the Pfizer immunization for 12 to 15-year-olds as well. If we can get that population immunized, these are the kids that are working all summer, and you don't want to lose them in your workforce over the summer. So certainly getting those kids immunized is going to be important, and it will also allow us to get back to school next fall in hopefully a normal fashion, to have the sports, to have the band, to have the the concerts, to have the shows, to have in school one-on-one learning without masks. That really is the goal, if we can get enough kids immunized in the middle school and high school.
Yeah, that's thinking of what that will do for, heading back into the fall, and giving them that opportunity for a full and enjoyable opportunity for education, and that life piece that they've been missing is going to be really huge. And, I think of things as simple as, seeing my staff all together in the building. So those of us that are still working remotely, the closer we get to these numbers and these metrics, that 55% and removing remote work requirements, having all my staff in the building is going to be like the celebration day. That's going to be absolutely fantastic. And I know there's other, businesses out there who are looking at that, who are not front facing, frontline workers, that having that back is going to be huge. And as you said, we're so close. And I've heard of some businesses offering incentives for employees to get vaccines, or education.
Whatever it takes.
Yeah, whatever it takes.
A lot of younger people think that maybe they don't need to get immunized. They're not high risk. They're not going to get sick with COVID. But I can tell you that that's absolutely not true. Now that we have a lot of older people immunized for COVID, the people that we're seeing in the hospital are younger people. Younger people can get very sick with COVID, as demonstrated, in India and in South, America, and even here in the United States, we're seeing more younger people get sick and ill and hospitalized with COVID. So not only will you protect yourself, you're going to protect the community and other people, from COVID as well. So this is very important, for the younger people, even if they don't think they're at risk, to get immunized, to prevent the spreads and allow them to do the things that they want to get out there and do.
Exactly. And you said it too, that, a lot of the numbers and a lot of this most recent surge, which, let's say we are coming back bringing that back under control, but vaccines have increased too, so that we kind of knew that was going to happen. But a lot of the most recent surge that Michigan has seen was not with the 65 plus age group, because they were vaccinated. It's definitely, there is a large gap between that 25 to say 54 person, even 20 and under, that have kind of skipped the vaccine process, or, I'm not going to get really sick. But as you said, that is truly not the case. And so if not for yourself, for the benefit of your community and getting back to those things you really want to do, concerts and things that, yeah, we can do some outdoor things this summer, limited, very limited under our orders right now. But boy, I don't know about anybody else, but I'd love to go see an indoor concert someday again soon. So there's a lot of things, or go to a conference, things like that, that if you're in that 20s and 30s age group, it's still an opportunity for you to kind of get to that by getting that education and seeing if the vaccine is a choice that you can make. What do you think?
This is where we're seeing most spread is in teenagers right now. This is the group where the susceptible population where it's trending and transmitting.
What do you think is, obviously we still want to keep some best practice ideas out there. So if we're leaving everybody with something, one thing is that, a lot of the most recent epidemic orders and things that we've seen are all kind of showing that, okay, you can do more with a vaccination than you can without. But even so, I think it's still important to make people understand that when you're indoors at a business at this point in time, vaccinated or unvaccinated, you need to wear a mask, kind of keep your distance a little bit. Let's make sure that we get through what we know is going to be a really, really busy time in the safest and smartest way possible, because it is a combination of the vaccine and the mask and the distance and the washing your hands, right?
Yeah, it's all important. We know that masks work. There's data, there's science, it's proven masks work. So, even as we get people immunized, we're still going to need that mask component, especially in closer quarters, crowded situation to prevent spread. So it's all important. But this is the way forward, mostly the immunizations and the masking. We'll get there, but everybody needs to do their part.
I think that's the perfect way to end it. And things are well at the hospital right now. Numbers are back down a little bit, correct?
We are trending down a little bit. We have about 10 to 12 patients in the isolation unit. A couple of weeks ago, we were about 20. So we still have a significant number of patients here. It's not gone, but it seems like the grip is slowly releasing on COVID here at the hospital. Hopefully we're getting through this wave. And as we get more people immunized, I'm hoping subsequent waves will be smaller and smaller.
That sounds like a very good thing to hope for, and I think a very realistic thing to look at. So thank you very much, Dr. DenBesten, for taking a minute. And if, like you said, if people have questions and concerns in regards to the vaccine or want more information, they can reach out to you in the hospital or the health department to get more, and we'll make sure they have those contacts. And unless there's anything else.
I mean, that's what I'm here for, to, get the good information out there. These vaccines are amazing. They're highly effective. They're safe, and a lot of the myths and concerns out there. I'm happy to talk people through these, because a lot of them really don't have any merit or validity to them. But they're excellent, good, safe vaccines.
Excellent. We appreciate you taking your time. We appreciate you as a resource as well, as we look to get back to business and back to a more normal lifestyle in the future to come. As you said, we're so close. It's on the horizon now. So we have those metrics, and now we know what we need to work for. So appreciate your time. Thank you.
Right. So we got to get there, huh? Thank you, Nikki.